Hello, it's 9 o'clock, so we've got a bunch of people who've joined us already. I'm really glad that folks were able to join us across time zones. So we're going to go ahead and get started. And I want to welcome you all to the VillageReach webinar, where we will be discussing the evolution of CCPF Health Center by Phone and the transition of that program to the Malawi Ministry of Health and Population. My name is Jennifer Crouch. I'm the Development Director here at VillageReach, and I'm very glad that you all joined us here today. We have a wide variety of people on the line today, so we are hoping that we can give you all some great information that you can walk away with. Today, we have a panel of 3 speakers, and I'm going to ask them each to introduce themselves briefly.
Good morning, good afternoon, good evening from wherever you are in the world. My name is Alinafi Kasia. I'm the Country Director for VillageReach in Malawi.
Hello, everyone. I am Upile Kachila. I'm the CCPF Program Manager for VillageReach in Malawi.
I'll say good evening from Malawi. My name is Nedson Fosiko. I'm the Deputy Director of Clinical Services in the Ministry of Health. Welcome, everybody.
Thank you all very much. We'll be hearing first from our panelists, and then during the last 15 minutes, we will have Q&A. Those of you who are on the line will be muted during this presentation, but you can submit your questions at any time through the chat icon that you'll see at the bottom of your screen. And when we get to that portion of the program for Q&A, I will direct your questions to the panel. So to get started, I'm going to turn this over to my colleague Alinafe to provide some background on VillageReach.
Thank you very much, Jane. So VillageReach works with governments to solve healthcare delivery challenges in low-resource communities. We focus on the last mile, or the point at which services are delivered. And our work improves the lives of more than 35 million people in sub-Saharan Africa. VillageReach has been working in sub-Saharan Africa for 20 years. We have 3 primary offices, which are located in Democratic Republic of Congo, Malawi, and Mozambique. But we also partner with non-government organizations and governments in other countries in sub-Saharan Africa. So our work extends beyond the 3 core countries that I've talked about. To maximize our impact, VillageReach focuses on 3 areas of the health system. One is the health workers. We support health workers so they can deliver quality care to their patients. And in this, we look at how our solutions can increase efficiency. 2 is where we also look at access to products, and we realize that one of the greatest challenges at the last mile is access to products. And we design supply chain systems that distribute medical commodities to the last mile. And lastly, we also focus on data systems because we believe in the importance of data for making smart decisions. And we integrate data-driven decision-making at all levels of the health system. And with that, I'd like to now turn to Pile and Dr. Fosiko to speak a little bit about what CCPF is and who it serves. So, Pile, please.
Great. Thank you very much, Alinafi. So one of the ways VillageReach helps to improve the capacity of health workers is through the solution which is called Chipatala Foni, which means Health Center by Phone in Chichewa. And we commonly refer it to as CCPF. CCPF was designed and created in partnership between VillageReach and the Malawi government in order to improve access to affordable health care information and to increase the reach into the last mile. And this is where we focus our interventions at. CCPF is now a national program operated by the Ministry of Health and Population of Malawi and is now and is considered to be a key element of the health system. It is professionally staffed. It is a free hotline that provides health and nutrition information, and it is also available 24 hours a day, 7 days a week. CCPF provides accurate government-approved languages on a variety of health topics. Callers can present questions that range from information on maternal, newborn, and child health, diseases, fevers, diarrhea, cancer, sexual and reproductive health, and many others. It is available to around 18 million people nationwide, As of last year, the hotline operators answered over 48,000 calls, and demand has been seen to be steadily rising. At this point, let me turn over to Dr. Fosiko to provide us a perspective from the Ministry of Health. Dr. Fosiko, over to you.
Thank you, Billy. Again, Ministry of Health is delivering health services in Malawi using the Essential Health Package, which tackles mainly the common causes of illnesses and deaths, of which maternal, newborn, and child health are a priority area for the Ministry of Health. So in 2011, as we were trying to achieve the Millennium Development Goals, Ministry of Health, in conjunction with the Concern Worldwide, we thought of coming up with some innovations on how we can improve maternal, newborn, and child health services in the country. And a call was floated to the public and other partners that VillageReach now submitted the concept of Chipatala Foni, and it looked very attractive. And this Chipatala Foni, the health center by Foni, was piloted in one of the southern region district called Balaga district, and it proved to be very, very efficient, because amongst the services at the health center, there is part of the health worker that they have to take part, and the people or the patients or the clients for the health center also have to take part. And then there's need for information sharing on so many health activities for people to participate in their health care services. So in trying to promote that, the innovation came along that one, and Chipatala Foni really just does that. You may want to know that Malawi is not spared in terms of the human resource for health. There is a high vacancy rate in the health system, and that puts a lot of strain on the health workers. They don't have much time to explain things when they're seeing patients at the health center. But yet, it is very important to involve the clients in the participation of their management of whatever case they want to manage. And again, the public needs a lot of information to get empowered on promoting their health. So with that, Chipatala Foni facilitates the information to the people. And it was discovered that there is a lot of the cell phone coverage is relatively good in the country. And almost everybody or somebody else in the village has got a cell phone. So it was a matter of using this cell phone technology now to deliver the messages to people. And that's why this Chipatala Foni was a good concept, and especially that it was developed amongst the people, from the people of Malawi themselves. So VillageReach facilitated that. And you may want to know that the people that we are talking about, the majority in Malawi are the youth, and especially the adolescents. They don't have access to health services. They are shy to possibly see the reproductive health services or to access the reproductive health services, but Chipatala Foni provides enough information for them to do so and empowers them to get those services. And since Ministry of Health also is now delivering the services now strategically, that the Health Sector Strategic Plan 2, which we are following now, we are implementing now, is aiming at delivering quality health services, access to quality health services. And this Chipatala Foni just facilitates the quality health services. That's all I can say for now. And I can happily say we are very proud that government, together with its partners, VillageReach and others that support the VillageReach, especially the donor partners, we are able to implement this service to benefit Malawians. And we hope this can be extended to the whole Africa, actually. When you're in Malawi, let me invite you to call 54747 to access Chipatala Foni, and then you can have a feel what Chipatala Foni is. Thank you.
Great. So borrowing from what Dr. Fosiko said, when CCPF was launched in Balaka in 2011, 3 years later in 2014, a study was conducted, and this study showed that CCPF was changing behaviors for the target population that were accessing the service. From the study, it was found that through CCPF, we managed to improve maternal, neonatal, and child health outcomes for the communities that it was serving. And because of this, VillageReach and the Ministry of Health decided to move forward with scaling CCPF to reach more districts in Malawi. In 2015, CCPF had increased to 5 extra districts nationwide, however, still providing information around maternal, neonatal, child health information. At the same time, CCPF formed an agreement with Airtel, which is a mobile network provider, which made the cost of the call to be free for users and for the government as well. Since 2015, Airtel has covered all incoming calls. The partnership with Airtel was very key to the ability to scale CCPF affordably and also enable the government to really come up with an ownership plan to become and visualize that the ownership was indeed possible. 2016 marked the official start of the transition process of CCPF from VillageReach to the government, when I was seconded to the ministry to really push the transition along. And in August of the same year, a CCPF steering committee was constituted. The mandate of the steering committee, which is comprised of both the private sector as well as the public sector, from the government that is, was to provide guidance and validation of the CCPF transition process, as well as provide technical oversight on the implementation of the transition itself. Later on, a memorandum of understanding between the Ministry of Health and VillageReach was signed in April of 2017, and this led to the relocation of the hotline from Balaka district to one of the Ministry of Health campuses here in Lilongwe in July of 2017. And this relocation really marked the beginning or the start of the nationwide expansion, to which a public celebration was conducted, and we were embraced by the Minister of Health to fully launch the nationwide expansion of CCPF in February of 2018. In late 2017, CCPF was expanded to 9 districts across the country and became a general health hotline answering questions on health topics from reproductive care to TB. And at this point, CCPF was also available in both English and Chichewa. As of August of the same year, the hotline added a module for adolescents, which answers in-depth questions around sexual and reproductive health, HIV, puberty, and other confidential topics that are asked by the youth. In 2018, CCPF scaled to the entire country, and by July of 2018, the hotline was answering more than 3,000 calls per month with an average length of 15 minutes per call. As of today, we answer almost 6,000 calls a month with a huge demand for more. Notably, in August of 2018, CCPF also became available 24 hours a day, 7 days a week. In this next slide, we'll share with you the data which was tabulated from a study that was conducted in 2018 on the impact of CCPF thus far. The study looked at users in the districts where CCPF had been rolled out and compared those to 4 districts that did not have CCPF at the time of the study. From the study, it was noted that the children of 91% of CCPF users had slept under an insecticide-treated mosquito net the night preceding the survey, as compared to 77% of non-users in the comparison districts. Impressively, the study also showed that 95% of CCPF users had their children vaccinated or at least received vitamin A at least once prior to the survey, compared to 71% of non-users in the comparison districts. 50% of CCPF users were referred to a health facility, and the majority said they followed CCPF's advice and actually went to a health facility. Of those who went, about 95% were satisfied with the CCPF referral advice that they were given. 57% of people also said they would still call CCPF even if it began to become a pay-in service. And this goes to show the level of commitment that CCPF has garnered within the communities, but also the shared value that the community sees through CCPF. The Malawi Ministry of Health and Population is in its final stages of adopting CCPF as its own, a transition VillageReach has supported for more than 3 years now. Throughout the transition process, there have been so many lessons that have been learned, but I can cite several, including one key lesson, which was that and for our work to be effective, there was need for continued planning with the government, as well as engagement with the government from the start in order to foster very good ownership from the government side. So although it started at the district level rather than the national level, everyone who was involved in the process shared a common goal of eventually seeing CCPF transition to the government sustainably and for the government to take it up to scale. Another key lesson that we learned was that as an effective strategy that has helped CCPF transition smoothly, the diverse partnerships that we have within CCPF and the collaboration that we have within CCPF has really managed to push things forward. Having partners that are quite enthusiastic about the transition and that are committed to seeing the transition move forward and to provide their support to the government even beyond the transition goes to show the value that CCPF brings not only to the communities that it serves, but also to the diverse partners that are operating together towards actualizing actual implementation of the CCPF transition.
So now we'll turn to a discussion on the transition to government, and I'll be asking Upide and Dr. Fosiko about their experiences through the process, and there are many experiences that they have. So first of all, to you, Dr. Fosiko, what has the Minister of Health had to think about in terms of transition? And if you can also address how have you had to prepare to take ownership of CCPF?
Oh, thank you, Alnafe. The Minister of Health, as I said, it is the one that called for innovation, and having been satisfied with the implementation of the CCPF and the impact, it was really decided by the Minister of Health Management that this has to be part of the health system. And since it was operating as a project, now we have to factor it into the system and find out who is going to be operating this. So that's what I can say for now, that Minister of Health has embraced the Chipatala Foni fully. And the experience through the process has been, there are a number of things that needs to be done. Ranging from policy to implementation, because through the policy, the Minister of Health role, and again, with the decentralization that has come in place, Minister of Health does not implement services, but provide guidance and leadership to deliver of health services. However, that had to be embraced. So temporarily, the Chipatala Foni is being housed under the Director of Clinical Services in the Ministry of Health. And that's where all the organization of Chipatala Foni and the implementation of Chipatala Foni is being done. And we have to come up with ranging from the human resource that are going to operate Chipatala Foni, since we are going to inherit the equipment and the technology, the infrastructure that is there, like the building is already a Ministry of Health building. And that's, so far that's what I can say, and the processes are in place. We have done a lot so far. That the Chipatala Foni is finding a home under the Ministry of Health. Right now, it's going to be operated under the Director of Clinical Services, as I said, and we are supposed to come up with a framework on how it is supposed to work, and that is work in progress.
So, Dr. Fosiko, I think being on the ground, I'm privileged to see the commitment of the Minister of Health and the leadership that you're providing. But for our audience around the world, I think what I wanted to ask you is what, one to two things that you've had to do, in terms of taking over ownership of CCPF. What has the ministry done? So what are those 1 to 2 key steps that you've actually put in place so it can facilitate that process towards taking over the ownership of CCPF?
As I said, that we had to look at the policy and look at the structure of the health system in Malawi and see where we can put Chipatala Foni to function properly. Because this is a new innovation and it had to find a space somewhere. Because we couldn't target to, since it is like a national one, I always prefer to say it's a one health center that is that can multiply into so many health centers to the extent that I've said Chipatala Foni has provided a new health center in each and every district. So, but to be implemented, it needed to have a housing somewhere. That's number one thing that we have been thinking. So who is going to be operating Chipatala Foni? And as clinical services, since we are leading in the delivery of health services, we are taking that responsibility, but the provision of the information then becomes cross-cutting because there is preventive information that needs people need to be given. There is clinical advice that may need to be given. Chipatala Foni doesn't make any diagnosis. That's some of the things that we needed to come in to the extent that we have revised the modules accordingly. Together with VillageReach, we have worked on the modules and how they are going to be handled to provide the leadership on how to provide the service. And secondly, one of the areas that we thought was the financing of Chipatala Foni. How is it going to be financed? We know health financing is already a challenge, but we have to find where the budget for Chipatala Foni can be aligned. So far, as I said, clinical services is through, that's where the finances to the Chipatala Foni are going to be channeled through. And another thing is the policies. The policies, has everything that is going to be done by Chipatala Foni has to be aligned to the policies in delivery of health services. That means some of the policies need to be revised and guidelines being provided. And the maintenance of the technology itself is another thing that we thought about. This time around, the technology is there is a lot of technology that is coming into the health system, and we have to find means and ways of managing that. But the two critical areas that, if I can say, the transition, the preparation for the transition is that it was led by a task force. We have to make sure that there's a task force that is going to make sure that all the things that are required for us to take over Chipatala Foni are in place. And I'm happy to report that VillageReach has been doing very well in terms of coordinating and working with Ministry of Health to ensure that the transition is functional. And this transition has gone to the extent of even advocating, preaching about Chipatala Foni across the country. So that people should know that there's Chipatala Foni that they can use. And that is it's an ongoing process. It's going to continue, but the leadership is being provided by the task force.
All right, thank you very much for that response, Dr. Fosiko. So from the government side, and briefly, what are some of the lessons learned on either taking ownership of a program like CCPF or working with an organization like VillageReach?
The lessons learned are that one thing is that two people do not go in the same direction without discussing. People have to agree in terms. Government of Malawi has got its own rules of implementing things. Now, partners have got their own rules of working. So somewhere there must be a bridge and some tolerance. So that is a very important thing, that there must be a good relationship between the partners in health and the ministry, the Ministry of Health or Government of Malawi, which we have witnessed that the Government of Malawi and Ministry of Health, through the planning department, a lot of coordination is being done to ensure smooth partner relation and partnership and collaboration in the delivery of health services in Malawi. So that's one lesson we have learned, that our good relationship can achieve more. The opposite can be true. If there's no good relationship, no innovation can be brought into the system. Otherwise, health is a broad area that needs to be, people need to work together. And another lesson is that, health financing is a challenge, a big challenge for everybody. And now, as we are increasing services, this is a new innovation. We must be prepared to give it a budget. So it means when you want to innovate, you must be prepared also to provide resources that are required for the innovation. And in Malawi, we have experienced that yes, the will is there, but sometimes the resource, in terms of financial resource and human resource, is another thing that we need to prepare maybe in advance, and also be flexible to accommodate some other things. Those are the major two lessons that I can.
Yeah, now you've raised some good points there in terms of the good relationship that needs to be established, and also the health financing aspect that needs to be thought through. So, Dr. Fosiko, obviously there are challenges. So what we wanted to hear from you is, what are some of the unexpected challenges that you have faced in the transition?
One of the biggest challenges that some other times things are not well aligned. So when we thought about taking over Chipatala Foni, it showed a very good innovation, and it still continues to be a very good innovation. But Chipatala Foni cannot work in isolation, or Ministry of Health does not work in isolation. That means we have to look at the whole system. The regulatory part also needs to look at how Chipatala Foni is going to be regulated, because Chipatala Foni does not make any diagnosis. We only provide health information that may be lacking to either to the patients or the public, that will help them to empower them so that they can promote their health. So the regulation is another area that is a challenge, because this is a new innovation. So we try as much as possible to work with the regulatory bodies to ensure that at least the Chipatala Foni is going to be accepted. The system is not going to repel it. And again, another unexpected challenge is the people, the mindset, the people that are working in the health system themselves. Some, for example, clinicians or nurses may think that Chipatala Foni is not a good thing because they are giving information on health. What about confidentiality and all that? But we keep on explaining those, because in terms of confidentiality, it is 100% there, but it needs to be, we have to bring in some mechanisms that are going to ensure people that there is transparency here. I mean, we are accountable, and also we are very confidential. Ethics are being observed. So that's another area where we see challenges. And again, as I said, policies, they need to be flexible also. That means some other policies, we need to change them, or else to accommodate Chipatala Foni, which Minister of Health is very much well prepared to do that.
I think those are three key challenges that you're mentioning there, Dr. Fosiko. So I think just to speak a little bit more about what have been the key elements of transition which have been so critical. I know when you're talking, you mentioned areas such as alignment with the policy and the services of the Ministry of Health. You talked about the task force set up from the Ministry of Health side to be able to guide the process. But to you both, Dr. Fosiko and Upire, what have been the key elements of transition which you think have been most critical?
I would cite three. Leadership and governance was very critical. When I talk of leadership and governance, that's why our task force comes in. The task force was very, very critical. Without the task force, some of these things wouldn't happen, because we have to loop in some stakeholders, all the stakeholders, like all the departments in the Ministry of Health are represented in the task force team. And other institutions also are represented there from the academic side, from the health training institutions. They are also included in there. Even the regulatory bodies are involved in there to provide guidance, to make sure that at least we are moving in the same direction. That the leadership and governance, I cannot overemphasize on that one. But one thing we know is that we need to develop some more guidelines on how to guide Chipatala Foni. Since it's a new thing, the guidelines may not be very, very clear. So we'll be looking into the guidelines. You may want to appreciate we have got our health education unit, which does something similar to this, not necessarily having a hotline, but at least we have been using them as a route to disseminate health information. So we'll have to think on how best can we, what guidelines we need to come up with to ensure that we don't duplicate or we don't contradict ourselves. And yeah, you know, amongst the resources, the human resource for health is a critical element. And we don't have people that have been trained to deliver health services online. So this is it was a critical area to ensure that if we take over the health setup by phone, we should have enough human resource and the right human resource to operate it. It may not be the ones that are working in there, but this time around we don't have any choice because those ones are very well trained. We have to find means and ways of seeing how we can recruit them into the government system. That's one of that was another critical area, and the budget was another critical area because budgets are managed by institutions, and this one being that we are not, it's a service delivery point. So we have to find out where does the budget go to, and the challenge was that one to say where is it going to be housed. That was a very, very critical area, but we are getting over it. Yeah.
So, Dr. Fosiko, I'm privileged to know that the Ministry of Health, despite the limited resources you have, but there has been some commitment on the budget side to allocate some funds towards CCPF. Can you speak a little bit more briefly about that?
Well, yeah, as I said, the Ministry of Health is responsible to ensure delivery of quality health services. And this is bringing quality actually, because it's going to bring community participation. And again, we need our health workers to be on top of their information or health information. So the training part of it, developing the human resource, is something that is going to strengthen the health system and possibly deliver quality health services. So we just need to find means and ways of putting up a system that Chipatala Foni is part of it, of which is part of, right now is housed under the Directorate of Clinical Services. So Directorate of Clinical Services have to budget for that. And I'm happy to say the budget that we proposed, at least we were funded, we were going to be funded for Chipatala Foni for the first time, and this is a new budget line for Chipatala Foni. But in future, Chipatala Foni is set to have its own budget that is going to be managed by management team of Chipatala Foni. In future, that's what we are looking at.
Yeah, no, thank you very much for that, Dr. Fosiko. And yes, I think by allocating resources, you are definitely demonstrating that commitment you have to see this service, continue within the Ministry of Health. So to you, Ophelia, I think the same question in terms of what you consider to be the key elements of transition that have been so critical. In brief.
I think so this is a unique partnership that we have at the moment. So getting everyone involved and engaged from the start, having the partners and donors know the end goal of the transition, but also having the Ministry of Health understand their obligations with regards to the transition. So having that conversation at the very beginning has really helped to map the progression of the transition as well as the achievements that have been derived at throughout the process. And getting that conversation had also reaffirmed the level of commitment and support that we have since received from different partners and donors to even pledge continued support and partnership with the ministry beyond the transition, mainly because they were engaged from the start and they knew what they were getting into, and they had a way of envisioning themselves coming up with this critical partnership. So I think having that conversation at the very beginning has really mapped the roadmap of the transition. One other element that I can cite that has really been critical to this transition is the relocation of the hotline from Balaka to the central location where it is as at now. It provided an opportunity for different stakeholders to really come to the hotline, to monitor our operations from there, but also the move itself communicated to the donors and partners the intent, the strong intent that the Ministry of Health has with regards to the transition by giving us a building and moving the hotline from the district to the central level. It further reaffirmed the commitment that the ministry has to see the transition forward. So this move was quite critical, and it opened up and unlocked several other doors, as we have seen a number of donors trickling into the hotline to observe operations and get an interface with the hotline system so that they can easily visualize how they become part of that equation. So I think these two were quite critical, but also just to add on to what Dr. Fosiko mentioned on the partnerships, I think this has actually been one of the critical catalysts that has driven the transition forward. So having all partners know their roles, VillageReach knows, fully understand their role, the Ministry of Health fully understand their role, and how we can collaborate effectively in order to ensure that all our obligations are met and we're able to move the transition process forward. I think the unique partnership that we have really speaks volumes of how CCPF has grown from when it started in Balaka to where it is as at now.
But maybe just some seconds to emphasize on the partnership. It was really critical because this demonstrates something very big, that health is just Ministry of Health. Health, everybody has to take part in ensuring health promotion. That's why you see what Airtel does is very, very incredible. And even the development of the MOU, we involve all the ministries. The Ministry of Justice comes in. And all these donors that have been mentioned, I want to challenge all of us to say, whatever we are doing, well, health is not everything, but there's nothing without health. So everybody has to participate in health promotion. So this Chipatala Foni, the partnership in Chipatala Foni, demonstrates the need and the emphasis on collaboration and partnership in delivery of health services.
Yeah, thank you very much for that. I think these are all very important points that have been mentioned here. And I'd like to thank you, Dr. Fosiko, I think for the leadership that the Ministry of Health has provided, I think, throughout the process. And, one thing that's coming to my mind is we talk about institutions, I think, in terms of rules and policies, organizations. But I think one thing that we want to mention is that we need champions. I think in a process like transition, and I look at you, Dr. Fosiko and Upile from VillageReach, that you have been the, some of our biggest champions in seeing the process through, and I think that helps in driving this forward. That as long as we have these champions, in addition to the organizational commitments that are already there, I think that's kind of an added value in the process. So thank you very much for that.
Thank you.
Yeah.
Alanafe, that seems like a great turning point for us. And actually, we've had a couple of questions in our chat that pertain to the next topic that I think you were planning to talk about. People are specifically wondering what's next for CCPF, what is next for VillageReach, and what are our thoughts about how this could be implemented in other countries? Could you speak a little bit to the group about that?
Yes, sure. So I think the two next steps that I can talk about. One is that I think, as Upile has mentioned, the demand for CCPF has been increasing, and we're expecting more calls next year. We are a 24/7 service now, targeting all districts in Malawi. And so to be able to meet the growing demand, what we are doing is working with other partners, for example, Preket and Vayamo, to explore how we can integrate artificial intelligence and machine learning into the hotline. And clients will be able to ask questions through WhatsApp, which is the most popular messaging service in the world. And artificial intelligence and machine learning will also help us in terms of providing suggested responses to the messages that will be coming from the clients. And hotline workers will, of course, approve the messages that will be sent to the clients. And that will allow us, in terms of a small group of hotline workers, to save thousands of clients that call in or contact the hotline. This technology will also have other benefits in terms of helping us to follow up on clients and see if they went to the health center or if they did immunize their children. We could also use this technology to help the Ministry of Health and Population to identify and track disease outbreaks. And CCPF, as an example, was used to provide information on cholera outbreak in late 2017, where actually the information that came through the hotline was reported to a district, and they were able to take action to address that outbreak. The second thing that we're thinking about is, of course, how do we replicate CCPF? So as VillageReach, our model is to test a solution, and if it's successful, we kind of develop that solution further and then take it to scale. And if it's successful at scale, we want to replicate it in other settings, of course, in terms of adapting it to the context in that new environment. And because CCPF has been so successful in Malawi, we are looking at other countries which are also interested in integrating a similar service in their health system. So right now we are talking to governments and partners in Mozambique, Democratic Republic of Congo, and other countries that are considering how CCPF can add value in those contexts. And those ministers of health in these countries can add some basic hotline and messaging services, and they will be able to adapt, upgrade, and design their own integrated health center by phone that will suit the context in their setting. This is an excellent opportunity on our behalf. I think, when we look at this in terms of using the lessons learned from Malawi to provide healthcare information to millions more people in these other countries. Beyond DRC and Mozambique, of course, there is also growing interest from other countries, and we are interested in working with partners to bring health center by phone to these additional countries. So this is what we are working on, I think, in terms of the next steps. Thank you.
Thank you, that's great. Okay, so thank you all for giving us that overview both of CCPF and of how we're transitioning this solution to the Ministry of Health. We do have quite a number of questions from the chat, and so I'd love to direct a few of these to you. The first question was actually submitted prior to the webinar, but it pertains to one of the first questions we had as well, which is really about understanding the reach and capacity of Health Center by Phone, of CCPF. So the question that was submitted before the webinar was, in cases where the health facility is far away, how will the patient be assisted in terms of getting access to medication? And there were additional questions about above access to healthcare. Does the offering include e-prescription, EMR, or is this more about triage and medical advice? Perhaps Upile, would you take a moment to respond to that question?
Right. So with regards to the services that we offer, as Dr. Fosiko mentioned, we do not diagnose through the hotline. Rather, we just we provide health information and advice. So people can call in to ask questions pertaining to their health, and they do get advice that is aligned to the questions that they have presented. So once this advice is given, if in the event that the caller presented some critical conditions, we refer them to their nearest health center for further management, and we do follow back after 2 to 3 days to ascertain if, one, they went to the hotline, to the health facility that is near them, and two, if they were assisted, but also if their conditions have improved. So we do not diagnose, rather we just help, we provide health information and health advice.
If I may add on that, thank you, Billy. But if I may add on that, in terms of the accessibility, people that's the importance of the Chipatala phone really. It helps those people that are in the rural areas as long as they've got the phone and they can make a call. Because they are given, they call on different subjects. Some of them, they just want to have more information on how they can promote their health, maybe to improve their nutrition, to improve their hygiene, things like that, maybe to prevent some diseases. They'll be given some information. While some others will call because they have got some symptoms. And when they are calling because they have got some symptoms, they are given proper advice. What Chipatala phone does, they probe the symptoms to check if there are any danger signs. For example, a pregnant woman that is having a vaginal bleeding, that would be a danger sign to a pregnant woman. So they would want to make sure that this client has been given the right information to ensure that they don't complicate and they get health access as soon as possible. As I said, there's a need for advocacy, which we are doing right now, working with the district health offices to link up with the health centers, so that if we pick a client that is very far from the health center, we can also inform the system so that they can start responding. Malawi is developing the emergency medical services right now. Otherwise, we have just been operating ambulance services from the district health offices, but we are now trying to develop the emergency medical services, which Chipatala phone is going to be very closely linked, so that when there is an emergency, the emergency medical response will be triggered immediately to take care of those emergencies that are elsewhere. Whether health workers are going to follow there, or the communities will be informed on how quick they can access the health services. Because sometimes it's just a matter of making a decision, and decision making sometimes can be very far-fetching if you're not empowered. So we believe Chipatala phone, when it empowers people, people will have access to health services. Just to stress, don't prescribe, because we don't make any diagnosis, but we can prescribe at least some health information to empower the clients so that they can participate in their health care.
That's wonderful. Thank you both for that. To follow up, there were a couple of questions about the hotline operators in the call center. And Dr. Fosiko, you mentioned that there's a shortage of health professionals. Could the panel speak to the personnel that we typically use in our call center? And perhaps you could elaborate on that a little bit to talk about how we decide what information is approved and available for callers.
Thank you very much. The personnel that is working in the health center, yes, we don't have the shortage, and that's the importance of having, again, augmenting on the importance of having the Chipatala phone, because Chipatala phone will make accessible the little health workers that we have. There may be some of them that are in the rural areas, they will have access to the doctors actually, because Chipatala phone may not be able to answer some questions, and we have tagged some doctors to Chipatala phone, that the health workers in the Chipatala phone can divert the calls to other more health workers in the system, so that they can assist the client wherever they are. So the personnel itself is a very, very critical issue. And while we don't have enough, the Chipatala phone seem like bringing a multiplying factor of the little that we have.
And if I can add there, in terms of the, I think the hotline workers that we have, they are healthcare workers. So at a minimum, I think you're looking at trained nurses and midwives. You're looking at medical assistants, clinical officers that are operating the hotline. So these are all healthcare workers that have been trained in the various aspects of their field. And so they are healthcare workers. I think that's the bottom line, and that's what we want to see in terms of ensuring that they are providing the relevant information. The other thing I wanted to talk about is what Dr. Fosiko said, which is that calls can be triaged to doctors. And so there are doctors on call that, if a hotline worker who is a trained nurse, clinical officer, medical assistant fail to manage a call, they can triage that call to a doctor, a medical doctor, to manage that call. And all that information within the hotline that is being used, so they use protocols that are approved by the Minister of Health. So everything has to be vetted and approved by the Minister of Health in terms of how a condition can be assessed and what advice can be provided to a client, I think, based on what they are presenting at the hotline. Yeah, thank you.
Thank you, Alnafe. And actually, that's why I emphasized on one of the things that we taught policies and guidelines and coming up with the modules that are used in the hotline. These modules are informed from all our disease control programs and also from all our protocols that we have in the Ministry of Health. We have been able to tease those things that can be shared online. So in terms of the information that is delivered is really something that is coming from the Ministry of Health and something that the Ministry of Health needs to deliver to the community.
As a follow-up to that question, several people have asked, and I think that Upile and Alanafe, perhaps you could speak to this more deeply. How has VillageReach, we spoke a little bit in one of the slides about impact measurement, but can you speak more deeply to how VillageReach has conducted evaluation of the effectiveness of CCPF? And the question is about both sexual reproductive health, but also over and above sexual reproductive health. How have we been able to analyze the impact of CCPF, and what have we learned?
Thank you very much for that question. So, first of all, I think CCPF has gone through several stages. So, at the beginning, when the service started, after a couple of years, I think around 2014, we did conduct our first evaluation of CCPF. And also a few years later, actually in 2018, we were able to conduct a kind of a more comprehensive evaluation. So these evaluations have kind of guided us to understand in terms of what the impact of CCPF has been in terms of not just reach, I think reaching more people, but also in terms of the quality of the service, as well as an indication in terms of what has been an impact in terms of influencing behaviors of people who have actually called CCPF. So I think what you have seen from what Upile was able to present is that it has actually led to some adoption of positive health behaviors amongst the people who've got improved knowledge, definitely. We've also seen that a lot of people who were referred for services actually went for those services. So there are a number of areas where we actually see that action did happen for clients who've been calling CCPF. I think in addition to that, the fact that, of course, it has improved knowledge. So I think building in evaluations at critical points to be able to assess what the impact of the service has been most critical. But then I would like to speak a little bit more also about on routine basis, which is that we have two ways that we are tracking what is happening at the hotline. One is what we call the quality assurance process. So this is where we have built in quality assurance protocols at the hotline. So our senior supervisors at the hotline will sample some calls, listen to those calls, and then determine the quality of the advice that is being used, and use that advice then to help hotline workers or guide them in terms of how they can improve in handling future calls. And I think quality assurance is an important aspect of making sure that the service is responsive to the needs of the clients. The other thing is that on a monthly basis, we have our monitoring and evaluation team that is routinely tracking data in terms of what are clients calling about, where are they calling from, and what are the issues. And that data is used during regular hotline worker meetings. These are meetings that hotline workers have to discuss these emerging issues, in addition to the quality assurance issues, to make sure that the hotline, of course, is improving and is responsive to the needs of the client. So I think outside those two areas in terms of the quality assurance processes, protocols that we have in place, but also the evaluation processes that we have in making sure that we are tracking what the impact of the program is. And Upile can add to that.
Yes, and just to add on what Alinafe has said about our internal quality evaluation systems, we do run quality assurance assessment, weekly, monthly, as well as quarterly, but also we're open to having external evaluations, assess our quality assurance and how we're sticking to providing Ministry of Health approved guidelines and how we're honoring the aspects of ethics, privacy, and confidentiality of our clients. So in our own internal quality assurance exercises, we have managed to track the output in terms of meeting the minimum standards of quality. But then during the past impact evaluation, when we had an external group of people evaluate our quality assurance, they actually noted that we were kind of being very hard on ourselves in terms of ensuring that we meet not less than 80% of the quality assurance score. So they actually praised to say we have put in very strict quality assurance mechanisms in place, which was they found to be quite effective. And for that reason, we also do encourage that at any given time, anyone can come to the hotline to assess our quality assurance system, so that at the end of the day, we manage to provide services that are in line with the standards and the procedures that have been approved by the Ministry of Health.
And again, just to add on, sorry for cutting you, just to add on what Opila said and what Alnafa said, in terms of the evaluation, yes, the internal systems are in there, but the external systems also have been put in place where I remember last year in 2018, VillageReach engaged a monitoring and evaluation firm that went across the country where CCPF was being implemented to just have the field to collect information to see how people are using CCPF and more information that could inform the implementation of the services through CCPF. And the results were very much encouraging. Those are some of the results that Opila was extracting and presented to us here. And the most important thing was that people felt it was a very, very important tool service. And then they were also that they are willing to continue using it, and even if it means paying for it. That came from the study that was done in the districts where CCPF is being implemented. Of course, right now it's being implemented throughout the country, and we have got systems of collecting information or to get the perception of the people on our services. So in terms of the evaluation on the impact of CCPF, that's what I can comment on.
Thank you for adding that. You didn't cut me off. You actually said what I was hoping someone would bring up, which was exactly that we had an external evaluation done last year. And though the results of that study are not quite published yet, they will be on our website, the VillageReach website, which is villagereach.org, by the end of the summer. And if anyone on this call is interested in getting access to that, we have a deck, a slideshow presentation that I would be happy to send to you. So if you're interested, please let me know. So given the hour, I want to bring our program today to a close. I want to thank all of our panelists, particularly Dr. Fosiko, for taking the time to join Alanafe and Upile, at our offices in Malawi. We'll be sending out a copy of this recording as well as a link to a great video about CCPF that was also done this year. And we would be happy to send a few links that were mentioned in the chat. There was a mention of a British Medical Journal article that was recently published. We also were recently published for our transition in the Stanford Social Innovation Review, and I will send some links out to all of you in attendance about that. If your questions didn't get answered today, please feel free to reach out to me either by email or by phone. And we hope to do more webinars like this in the future. So we'll be sending out a follow-up email that asks for your feedback. We'd love to get a survey from you about what you'd like to hear more from VillageReach. So thank you so much for joining us, and I hope that you all have a wonderful rest of your day or evening wherever you're located. Thank you.
Thank you.
Thank you very much.